Well, now it's officially 10:30, and I know everybody has a ton going on, so we'll go ahead and get going and let you all get back to your day. So welcome. This is kind of the kickoff to something we're going to start trying to do monthly. There's just sometimes some updates and things that come along that we try to catch you on our calls and those kinds of things, but it seems like we are just wanting, it's just easier to maybe have one touch base a month. This won't be a little bit longer because we have a few more items to go through, but moving forward, we'll try and do maybe like a 15 to 20 minute just touch base. Any updates you're hearing, updates we're hearing, and then any questions we can answer for you and let you get back. It would surprise me if this ends up taking an hour, but we're happy to stay on for an hour if you guys have things you want to chat about. So anybody that doesn't know me, my name is Dana Steiner. I work on the HQIC project with the Nebraska Hospital Association. Joining me also from NHA today are Margaret and Amber, and I'll let them say hello quick.
Hi, everyone. Happy holidays.
Good morning. Thanks for joining.
All right. So what is hold up. Let me see if we have my slides.
Yep, just started.
There we go.
Forward it.
Hey, look at that.
DLT's at 11.
Okay, so the things we're going to go over quick today are just HQIC progress, some updates in CDS that some of you have seen as you put data in, some recognition that we're going to start after the first of the year, an annual survey for the HQIC program, and then surveys for our learning cohorts. And then we'll just quick go over some of the upcoming events and then touch on a few NHA updates. So the first thing we're going to have you do is just do an introduction. I don't feel like I can see everybody's name to call you off, but we're just going to, your name, what you do in your organization, where you're from, and then either a favorite holiday baked good or even a favorite holiday activity just to get us in the mood for Christmas at the end of the week. So I'll start. The first person I can see on mine is Sarah Veck.
Hey, Dana, do you want to go to the next slide?
Yeah, I do.
We're still on the title page.
Why? What? Well, why is that? Okay. Whoa, what do I do there? What do you see now?
Same thing.
Oh, well, hold on.
Unshare and reshare your screen.
Okay, thanks, Bob. What do you see now?
Objectives.
You're just seeing my picture of my kids, huh?
No, we can see the PowerPoint.
Yeah, PowerPoint.
Oh, you can? Okay.
Yeah, we can see the objectives slide.
But it looks, oh, hold up. See what happens here. Now what do
we
you
see
see?
your kids. Oh, now we see.
There we go.
There we go. You're in presentation mode now.
Do you see the objective slide?
Yes.
Okay, so I'm going to move forward one. And do you
It
see
works.
the introduction slide? Hey,
Yep.
Thank you for your assistance. I appreciate it. So now I know who I would have called if my microphone really wasn't working. Okay, let's try this again. Well, Bob, you moved yourself to the top by talking, so now you get to introduce yourself first.
Okay. I'm Bob Kentner. I'm the infection preventionist and quality manager at Sydney Regional Medical Center. And then you wanted a holiday thing, right? Is that what we wanted? What am I going to do this holiday? I'm going to sleep. That's what I'm going to do.
Perfect. All right. Kay Decker. I don't know first name on that one. Are you there? Oh, no. Oh, there you go. Oh, now you're muted. Okay, we'll go on to Amber. Amber, are you there?
At this special time of year.
Yes, Amber Lubin from Kearney Regional Medical Center. I'm the Director of Quality and Patient Safety. And my favorite holiday baked good are scotcheroos.
Perfect. All right, Diane? Hector? You there, Diane? I don't hear you. How about Bethlehem Cooler?
I'm here. Can you hear me?
Yes.
Okay. My name is Bethlehem Cooler. I'm the Quality Assurance Coordinator at Jimmy Melham Memorial Medical Center. I would also have to say scotcheroos.
All right, Valerie Hangman?
Can you hear me?
Yep.
Okay, good. Valerie Hangman, Providence Medical Center. I am the Director of Quality Assurance and Performance Improvement, and I like peanut butter balls. I don't know if you call that a baked good, though.
It counts. Awesome, thanks. Kathy Middlesworth.
Hi, I'm the Quality Director and Infection Control here at Kearney County Health Services in Minden. And my favorite holiday baked good would be peanut butter balls as well.
Tara Polinsky.
Hi, I'm Tara Polinsky. I'm the Patient Safety Quality Improvement Coordinator at Butler County Healthcare Center in David City. And my favorite holiday goodie would probably be cherry mash.
Thank you. Brittany. I don't have a last name.
Brittany Hayden at Brock County Hospital and Long-Term Care. I'm the quality manager. And my favorite holiday baked good is caramels.
Very good. Judy Sondra. No, Judy? All right, we'll move to Michelle George.
Good morning, Michelle George, Quality and Compliance Officer with Nebraska Spine Hospital here in Omaha, Nebraska. And there's so many of my favorite holiday baked goods, but I'll just say one, the oatmeal chocolate chip cookie.
Maxie Smith.
Hi, I'm Maxie Smith at Nemaha County Hospital. I'm the Director of Quality. And actually this past Saturday, I did a lot of baking, so it's hard to choose just one. This year I did Oreos dipped in white chocolate. So I would have to say that would be my favorite. That was a first.
Yummy. All right, Elise Kruger.
I'm Elise Kruger from Avera Creighton Hospital. I'm the Quality Improvement Coordinator there. My favorite baked good would be, my family makes them. They're called butter rum cookies, and they're like super finicky to make, very fragile, but they are delicious. So.
Very good. Shelley Graham.
Good morning, Shelley Graham, Memorial Hospital in Aurora. I am the Director of Nurses now, and I love a sugar cookie. I have with me Jenna, who is my replacement for Quality Coordinator. I'll let her introduce.
Hi, I'm Jenna Watson. I'm going to be the new Quality Coordinator here at Memorial. My favorite holiday baked good would probably be peanut clusters, homemade peanut clusters.
Oh, very good. Awesome. Welcome. Thank you. Jeannie, Timmy.
Good morning, Jeannie Timmy from Boone County Health Center. We do quality and risk management, employee health. And there's so many great holiday goods out there, but probably English toffee would be my favorite because that's the only time I get that. So thank you.
Good, thanks. Stephanie Moody.
Hi, I'm Stephanie Moody. I am from Thayer County Health Services. I'm the quality coordinator, and my favorite baked good would probably be chocolate covered cherry cookies.
Krista Trimble.
Hi, this is Krista Trimble at Pender Hospital. I am the manager of quality, risk management, and compliance here. And my favorite baked good is anything I don't have to make myself. But particularly, I like my mom's sugar cookies.
Very good. Gina Kerner.
Hi, this is Gina from Johnson County Hospital in Tecumseh. I'm the Quality Director, Infection Control, and Employee Health. My favorite holiday, it's not really baked good, but I love peanut brittle this time of year.
Amanda, is it Reznicek? Sorry if I butchered it.
Yep, no, you did it perfect. So
Hey.
Amanda Reznicek with Saunders Medical Center in Wahoo, and I am the Performance Improvement Coordinator. We have a family recipe for a Danish pastry called kringel, and that's what we look forward to.
Very good. All right, Jackie Zickman.
Good morning. I am Jackie Zickman, and I am the Infection Control and Employee Health Manager at Grand Island Regional Medical Center. And my favorite holiday baked good is the breakfast casseroles that we bake on Christmas morning.
Ah, very good. Carmen Schreider.
Carmen Schreider. I am the Quality Improvement Coordinator at CHI Health St. Mary's in Nebraska City. And I would have to say the candied nuts, because they only come out once a year.
Right. Very good. Amber, oh goodness. Medinen, I don't know that one, sorry.
It's close, Mietnin. Hi, my name is Amber Mietnin. I am the risk coordinator at Kearney Regional Medical Center, and I would have to say my favorite holiday baked goods is definitely the sugar cookies with extra frosting.
Thank you for correcting me on your name. Michelle DePries.
Hi, this is Michelle DePrey-Kreisels. I work at Memorial Healthcare Systems as the Director of Quality. I like, honestly, anything chocolate. I'll eat it.
Perfect. Who do I miss here? Jenny Meyergard.
Hi, this is Jenny Meyergard. I'm with Franciscan Healthcare in West Point, Nebraska. I'm Infection Control, Employee Health, and Safety Coordinator.
Good. Denise Sabatka.
Hi, I'm Denise Sabatka, Director of Quality and Risk at Saunders. And my favorite baked good is really anything with sugar, but particularly this time of year, sugar cookies are good with frosting, but I always love scotcheroos.
Perfect. Judy Bors.
Hi, I'm Judy Bors, Director of Nursing at Memorial Healthcare Systems in Seward, and I love anything. Also, any desserts is fun, but probably homemade caramels is my favorite.
Very good, thanks. It looks like Team Madison, but I don't know the first name. Okay, Shelley Amack. Amack. There, Barb Ties.
Hi, I'm Barb Ties. I'm the Director of Quality at Phelps
Memorial Health Center. I also like pretty much anything that's baked, but my aunt makes a really good brownie for Christmas Eve night, so that's probably my most favorite.
Awesome, thanks. Chris Pfeiffer?
Good morning, good morning. Chris Pfeiffer here at Gothenburg Health with Quality Compliance and Infection Control. I think one other person said it, but we usually only do cinnamon rolls around the holidays, so we like cinnamon rolls is our favorite baked good.
Awesome. Kayla Ventecker, I don't know that one either, sorry.
Hey, I'm Kaylin Ventiger. I am at CHI Health Plainview, and I am the quality specialist and risk manager here. And I really love pecan pie.
Oh, very good. I see a couple phone numbers on there. Do you guys want to pipe up and tell me who's on?
Hey, Dana, this is Becca at Broadstone and Superior. I'm the Chief Quality Officer here, Infection Prevention, and any baked good is my favorite. I cannot choose what baked good is my favorite. So all the above.
Perfect. Or anybody I missed, because my clicking through when you popped on, it kind of changed my lineup. So if I missed you, please holler at me too.
This is Michelle Klassen. I'm the quality supervisor at Faith Regional Health Services in Norfolk. I like sugar cookies. This is the only time of year I make them.
Perfect.
Dana, this is Diane Vector from Highland County Health System in Alma, and I am the Employee Health, Infection Control, Quality Coordinator, and Risk Manager for our facility. And it's not really a baked good, but my favorite holiday treat was my mother's homemade divinity, which I don't get anymore, and you just can't find a good divinity recipe out there. So, and I'd like to wish everyone a Merry Christmas.
Thanks, Diane. Is that you, Ann Timmerman? I see an Ann on there that I missed.
This is Angie Barber.
Okay, anybody else?
Thanks, okay. I'm the Director of Quality Assurance at Beatrice Community Hospital in Beatrice. My favorite baked goods would be a toss-up between a turtle, because my family will actually sit down and make them with me. They're easy with the Rolos, and then I love peanut butter balls, but then that's when everybody disappears. So and leaves me to make them also. But anything like that.
Perfect, good, thank you. Who else did I miss? And I apologize in advance, sorry. Did we get most everybody covered here? All right, thank you. Sometimes those virtual introductions are tough, so thank you for playing along. I appreciate it. Okay, into the other stuff. Okay, so just a kind of overview, we talk about this kind of frequently just to keep us focused on what HQIC's kind of goals are. So always to increase patient safety, increase the quality of care transitions, and to improve behavioral health outcomes and decrease opioid misuse. And those have some cross-cutting focus areas, which are supporting local communities, supporting vulnerable populations, and reducing health disparities, and increasing person and family engagement. So those are the overall kind of goals of CMS's project, HQIC. Some of the key links and sites that we use in the project. So there's the Telligent portal. And I know initially when we kicked off this project, there was more of a need, I guess, to be in the Telligent portal because we did our gap analysis in there and a few different things. So now really the biggest thing it's used for is if you want to sign up for some of their education opportunities, which we try to keep those in our newsletters and things so that you are aware of them, but some of them you have to register through the portal. So if you're having trouble getting logged in, reach out to myself or to Amber, and we will get you signed back in because it does become inactive if you're not in the system very often. I'm not sure what the time frame is. I think maybe it's 60 days, but don't quote me on that. So that's, and also they link to different, just educational papers, evidence-based practice. There's, it's more of a, I guess, communication type site than anything. So the new specification manuals in there too. So they update that when they add measures to CDS, they update the spec manual on that site. So that's kind of what that's for. And then the second site we use much more frequently would be CDS, which all of you are, I'm sure, very aware of. So that's the AHA run system that we use for our database for the data that you guys put in, as well as the claims data that Telligent pulls over. And then the last one I just linked to is NHSN, for those of you that use NHSN for your HAI data or simply use it just for your annual survey. That's a link to that. So those are kind of just the common sites we go to. And if you are having trouble with your CDS, let me know too. I know I've had a couple people reach out in the past week that said they're making them update their password every time they log in, which is a real pain in the butt. So if you're having that problem, let me know. I don't know why it is, but I'll reach out to support and see if we can't rectify that, because it's hard enough for me to remember one password, let alone if I have to change it every time I'm in there. So we'll try and get that taken care of. So one thing that's a little different for those of you that were part of the HIN project is it seems that measures kind of ebb and flow a little more during HQIC. What we're seeing is that different state associations that are also participating in HQIC with us under Telligent maybe request a measure be added. And sometimes it goes onto your guys' dashboard, other times it doesn't. So we just have to kind of be aware of what's on there. Telligent recently added some new measures that some of you maybe have seen on your dashboard. They are all, well, not all, but the majority of them are pulled from outside. Some are coming from, oh.
I just got back and I'm late.
Yeah, oh boy. Okay, there we go. Some of them come from claims, others will be pulled from your NHSN data if you have conferred rights. So we're just going to talk through what those new measures are and kind of what they're going to pull. The one thing that's, well, I'll let Amber kind of get into the NHSN stuff more readily, but the first one is the 30-day sepsis mortality rate. And that measure is, so the other sepsis rate that we've looked at for quite some time was post-op sepsis. So it required certain procedural codes to have patients fall into that for claims. So this one's a little different, and your denominator is actually anybody with a sepsis diagnosis. So it will pull just your med-surg type patients if they have a diagnosis of sepsis. So this will look more at a mortality rate and probably will be more telling for the small hospitals that don't do a lot of surgeries or maybe no surgeries that fall into that denominator. So it might be one to kind of keep an eye on, as we are currently working on sepsis as a learning cohort and something we really haven't pulled from claims in the past. If you do see those claims data in there and you're wondering if numbers don't seem to fit what you thought maybe they would, let Amber and I know. We can do some digging with Telligent and kind of try to look more closely at what that is. The second addition that I'm going to talk about is another readmission rate, all-cause unplanned readmissions. And I don't 100% understand why they added this, because I'm not sure that it's any more telling than the other readmission rate that they offer. But basically, the numerator on it are inpatients that come back in 30 days. And that's, you know, initially what we have always looked at. And then your denominator are your Medicare patient discharges. So that is so the first one is all of them coming back to a facility within the same state. And then the next one is supposed to be if they get readmitted to anywhere. So I guess if they get admitted to a hospital outside of the state, they're going to include that. The other thing the denominator says is patients age 65 plus that are on Medicare fee-for-service coverage versus just a Medicare patient. So it might adjust your numbers just slightly, but I would not anticipate it being a hugely different rate from the readmission rate that's already being collected by claims. Now, it will look different than our self-reported readmission measure, because our self-reported readmission measure includes all payers as opposed to just your Medicare population. So that's another one you'll see on your dashboard being pulled by claims. The other couple are ones that we had as HIN. They pulled them out, but then didn't in HQIC, and now they are. It won't affect a ton of the critical access hospitals, but for those of you that have ICUs, it is going to start pulling your CAUTI and CLABSI ICU only measures if you define those within your NHSN data collection. So those are the other two that you may see. Like I said, all the critical access hospitals that don't have ICUs, it won't even be an issue, but just be aware that that will show up for those of you that report that way in NHSN. And I'm going to hand it off to Amber to talk about the last three.
Yeah, thanks, Dina. So the three that I'm going to talk about are the healthcare personnel influenza vaccination rate. I know some hospitals have outreached to get that added to CDS. So that's one of our MBQIP measures that everyone reports within NHSN. So they added last year's flu season and then this year's flu season. So you can kind of compare your numbers and compare it as a state as well. The newest one is the healthcare personnel COVID-19 vaccination rate, which that pulls from HHS Protect. So if you report those numbers to Knowledge Center, it just pulls from there. So all of these measures, I see Chris had a question in the chat about being optional or required. The ones Dana talked about were claims related, and the other ones pull from NHSN or HHS Protect. So nothing that you guys have to do. I know not everyone reports that healthcare personnel COVID-19 vaccine because that's an optional measure at this point. But if you have data, it will be in CDS. If you don't report that, it'll just say no data for you. So really nothing additional that you guys have to do. It's just there for your viewing and to kind of see your rates there. We'll go to the next slide, Dana. Okay, so now we'll move on to data entry and scorecards. Currently, all of your data should be entered through October 2021 in CDS for those 4 self-reported measures, as well as HAI measures that pull from NHSN. So whether you report to NHSN or you self-report those measures, we would like to see data through October 21. So that brings me to our scorecards that we sent out in September last. Those are due to be distributed again. So if you haven't received those already, they will be sending those within the next couple weeks. But we'd like to see data through the first 3 quarters of the year, so you can have a good picture of your performance for those three quarters of 2021. So that will be reflecting your self-reported measures, your HAI measures, and then claims data information. So claims we know is slightly delayed. So we're looking at January through June for those claims measures. But the other ones we'd like to see at least data in through September. So for those of you that have data up to date, be on the lookout for scorecards coming your way. Which also leads me into our deadline for those self-reported measures and HAI measures. You guys are familiar with our 45-day leeway for the reporting period, but I'll talk about our recognition tiering program here shortly, but November data will be due January 15th of 2022. So yeah, we'd like to see October data currently, and then the deadline for that November data is January 15th. Next slide. Thanks. So this leads me into the HQIC recognition tiering. We kind of laid this out at the COG Quality Conference if you guys were able to join that. But this is something that we are really excited about. We know that all of our quality professionals across the state work hard and they don't always get the recognition that they deserve. And we appreciate all of your guys' data entry and quality efforts throughout the year. So we want to kind of give you guys a kudos and a pat on the back for all of your efforts. But this is kind of the tiering that we are going to roll out next month. So you will be recognized for timely data entry, which is that 15th of the month. So Dana and I will be doing audits within CDS just shortly after the 15th of each month to make sure that everyone has submitted their data timely, and then you'll get recognized for those that timely data entry. You can earn goodie bags for your staff, recognition at the COG Quality Conference. And then you can even earn lunch for your team. So of course, as you go up the tier, we're going to ask more of you. So we know that a lot of you have already participated in our learning cohorts and have presented for us. So again, we just want to thank you for all of the hard work that you guys are doing and give you recognition for that. So I think data entry is how we're going to start it off. So get your data up to date, and we'll start auditing that here next month. Next slide, which this leads us into our surveys that we would like to send out. I'm going to put in our annual satisfaction survey here in the chat. So this is something that is new for HQIC. We'd just like to see how we're performing and assisting you guys. We want to be a good resource for you. We don't want to be a burden, and we want to support you in any way that we can. So this survey will kind of lay out how our cohorts are going. Are we doing webinars at the right time? Please give us your honest feedback. Like I said, we want to be a resource for you in your quality improvement efforts, and we definitely don't want to be a burden. So we are open to suggestions, different ideas on learning cohorts. If you're struggling with something, please give us your honest feedback. And I just put that survey in the chat. So if you guys could complete that, we'll also send it out in the quality newsletter. So more to come on that. And then post cohort surveys, we just wrapped up our falls cohort that we partnered with UNMC Capture Falls team. And I think it went really well, but we'd like your feedback as well. They kind of led that cohort because they're the experts, but I know a lot of hospitals had some small wins within that short time frame. So these post cohort surveys, since we're doing rapid cycle improvement using that model and just doing 3 to 4 months at a time, we want to make sure that we're supporting you, and that is useful for your team. So if you like that short cohort monthly type of webinar platform, or if you don't, let us know. We want your honest opinion on that. So we're currently in our sepsis cohort. So all of you that are participating in that will get a survey once that wraps up. But those of you that participated in the falls learning cohort, you will be getting a survey shortly to kind of give us some feedback on that. And I think I will pass it off to Dana again.
Thanks, Amber. Okay, so just some upcoming events and things we have going on. So some of you on the call are part of this team, and if you're interested in participating, let me know. But so a while back, there was a conversation with a group of leaders at an NHA conference, and they just were talking about kind of difficulties of transitioning patients to different levels of care. And unfortunately, it wasn't defined by one transition, to a higher level of care, to a lower. It was just some, difficulties in moving patients across the continuum of healthcare. So from that, we kind of had a brainstorming session to decided we would pull together a team and really just explore what we have in the state for transitions of care, where we have some barriers and some gaps, and maybe anything we can do to really help all of us in healthcare move our patients to where they need to be, to the level of care without a lot of work. And I know saying that right now to all of you is probably like a crazy thing to say, because I know how many of you have had trouble with that with the COVID situation. So that will be part of it, obviously, since that's the way we're living right now. But also beyond that, just in general, transitioning patients to the place they need to be in a seamless manner if we can. So we kick off in January. It's going to be more of a long-term project. There's such a breadth of things to talk about in transitions of care that we aren't 100% sure what we will focus on or how that will look. So the first meeting will really kind of be brainstorming and creating a vision for the project. And then from there, we will do some work groups and potentially bring in additional members just to really look at those barriers we're meeting each day in transitioning patients and hopefully make some headway on that. So you'll hear more about that over the next year. And like I said, if you have interest in that or input, let me know. And then next, in the middle of February, February 15th, we're going to do a delirium education. So NHA put out a CEO survey, and that was a resounding theme that more education on delirium would be useful. So we are having a couple different speakers in February really talk about, recognizing delirium, caring for the delirium patient, some of those things. So it should be good. And hopefully we're working on trying to maybe do a small cohort related to delirium following this. So really focusing on delirium screenings, implementation, education to staff on screening for delirium, and then care plans and how to best care for delirium patients in your organization. So more to come on that, but we're excited for the 15th event. You do have to register for that through the Telligent portal. And again, I know sometimes we're having trouble getting into the portal, so don't let that deter you from signing up. If you're having trouble that way, holler at Amber and I, and we'll get you squared away. So those are kind of our new big things coming up. And then Amber, are you doing the next two, or do you want me to do them?
Yep. No. Just to add to the delirium education, CEs will be available for that one. So if you have frontline staff or providers that would be interested in delirium education, they are more than welcome to attend as well. So please invite your team. NHSN update, we know that NHSN in itself can be a barrier with data reporting, and it's not the most user-friendly for small critical access hospitals. So Margaret Drake is our state expert on NHSN, and I know she's done some webinars in the past. So we just kind of want her to continue giving us updates yearly. So that is scheduled for February 1st. That's still in the planning stages. So be on the lookout for a brochure or a flyer with the registration link here very soon. And then the Data 101 conference, I don't know if I want to call it a conference, it's more like a workshop. March 24th and 25th, that'll be an in-person event in Kearney. We're really excited for this. We have 2 half-day sessions. The first half-day will be Amanda Bond, she works with the NHA, and she's our data analyst. She will really focus on learning the fundamental components of data collection and analysis. So bring your laptops. It'll be an interactive workshop. Bring some data that you're trying to work on, but really we want to walk you through collecting, sorting, and displaying data that will be useful and impactful for your team. So with that, that'll be the afternoon of March 24th. And then the morning of the 25th, we have Storytelling with Data, which is a national speaker. They do a great job. They have a couple books out there. I don't know if anyone's familiar with the Storytelling with Data book, but they really use 5 key lessons to tell a story using your data. So they focus on understanding the context, choosing an effective visual, eliminating clutter, focusing attention, and telling a story. So we're really excited for that. And we're most excited, I think, that it's going to be an in-person event. So more to come on that. We're just finalizing a brochure for that with registration stuff as well. So the audience for this interactive workshop will be any healthcare personnel that's interested in building fundamental data analytics knowledge or becoming a better data storyteller. So we're excited for that. And then I think we'll pass it on to Margaret for some NHA updates.
Perfect, thank you. Margaret Weppel, and I cannot stop thinking about all the wonderful Christmas candy you brought to my mind. I like all of it except for bourbon balls. That is something my family does, and they're disgusting. So don't add that to your family tradition. NHA updates, we do have a new president. He started a couple weeks ago. Jeremy Norquist is the new NHA president. Laura Redowdy is retiring the end of this month, so she's still with us through the end of December. But Jeremy has gotten started and is got all kinds of ideas of how to bring more resources to our members. So very excited for this next year with our new president. Let me give you a quick data update. So data wise, we are transitioning our platform to a new platform. Today, we started running hospitals' historical data through there. We're running 5 years worth of data, not all right now. We're starting with 2020, 2021, so we can get that back to hospitals, but we are going to go back 5 years. We have that, and that's for appropriate benchmarking. And look back, and then that way all the same filters have been run and cleaned that data. So we'll run that through. After the first of the year, we will train hospitals to run their more recent historical and current data. So Q3, Q4, 2021, hospitals have been holding on to that, so they will put that data through themselves. Again, this is your 837 claims data. So it's probably not you guys, it's probably somebody in IT or medical records. But what's coming next will be more applicable to you. So after that data has been run through, and then it's got to be cleaned and errors fixed. We have some critical errors, and then we have recommended errors. Then after that, it's going to go into another data portal, which is the NHA Dimensions portal. And that's the analytic part of the NHA data. And that's where really the exciting meat of it is. It will produce all kinds of standard reports. And also there will be a Tableau-based section in which you can develop your own reports. So for example, historically, these reports have included market share, pricing, a lot of marketing and finance type reports. Well, now any sort of quality metrics that go into your claims data, we can pull that up. There will be some canned reports, but in the Tableau section, you could look at readmissions. You can elect or select your own parameters. So you could look at female readmissions from the age of 40 to 45 and Latina women, and get that specific into your data. So very excited about this. You'll be invited to some training sessions late January, early February, where we can really showcase all the capabilities of this program. But what I do want to bear in mind is that there are more and more regulatory agencies requiring us to take a deep look into real data. That's race, ethnicity, age, language, disability. It's called real data. So with our new program, we are collecting the real data. We're working with your IT folks to pull it from the EMR into the claims data, and then we'll spit it back out to you. This is going to be a field in which you need to have something in each and every individual chart for it to go through that cleaning process, which means that we need to really look that we are making sure we're collecting that information at the bedside. So that's what I'm asking for you is to make sure that we are still and consistently reporting or collecting information on race, ethnicity, age, language, and then next will be disability. If it's not collected in the EMR, when it goes through the data cleansing system, it will pop up as an error. And then that will go to your HIM IT person, and then they will hound you for that data anyways. And so it's just better if we're consistently collecting it in the EMR. So before, we won't do this for historical data. It was never a requirement in the past, but going forward, January on, it will be a requirement to have that in there. So please make sure that it's there. If you have questions, if you want training materials, we did a whole bunch of training back in 2020. It's recorded and on our website. We can also help you with anything you need. So just pay attention to that. The Rural QI Residency Program. We are wrapping up year 2, which took 2 years because of COVID, and they have 2 more sessions. And then we are starting our next group, our year 3. They will start in March. So we still have a few spots left for that March start date. We do limit it to 20 residents per year. And so if you have anybody who you want just more information on the essentials of your quality program, you have somebody you want to train in quality, you know, you're thinking, I'm going to retire sometime, I need to start looking at who's going to be my replacement, or you just want some help. We've had lab personnel, HR, all of them have been helping with collecting of data and would benefit from this course. So let me know if that is something of interest to you. Get your applications in before the 15th of January. The Rural QI Steering Council is working on some CEO education. So out of the residency came the information that we just need something more concise for CEOs. So Amber Kavan has been taking the lead on this, and she would love any input, any help. If it's something you're passionate about, reach out to her. We hope that we will launch this at the end of the spring forum. It usually ends at noon on the second day. So we're thinking maybe we could keep the CEOs around and provide this optional 3-4 hour session. We'll see how that goes. So that's something to look forward to. The last thing is the NHA was awarded a grant to push age-friendly concepts into communities. So we're recruiting a staff member, but what we really need are 3 to 5 communities who are interested in working with this new staff member on age-friendly communities. So those 4 essential, the 4 M's, mentation, mobility, medication, and what matters. We've been working with lots of our hospital partners to look at how well they're doing this and how well those 4 M's are doing in concert with each other. Well, this grant is to bring in post-acute, so the nursing homes, and pre-hospitalization. So just a quick example, if you're going to work on mobility and look at falls, you've got a great fall program in your hospital. Well, this is going to help spread the word that maybe falls needs to be a consideration in the doctor's offices. Does your community, the church or somebody like that, have a fall or a fall prevention or a balance class for the community? And then what about post-acute? You know, are they taking the great things that are being done in the hospital to the post-acute arena? So this person that we bring in will work with all those entities and push the age-friendly concepts throughout the entire community and really get that continuum of care. So if that is something you are interested in, please reach out to any of us and let us know. And then finally, you know, COVID is on the rise. If you're having any issues, shortages with supplies, that sort of thing, Angie Ling at DHHS is our direct contact there. Her and Dr. Antone have been amazing. But if you need to get a hold of any of us, and let us know, and we can put you in touch with the right person, that sort of thing. So, all right. Thank you.
Thanks, Margaret. Okay.
All right, I think that I see we have some survey responses already, so thank you guys for filling that out. But we are here to support you. We want to definitely be a resource, not a burden. So I think most of you have scheduled reoccurring monthly touch base calls with either myself or Dana. So we love to visit with you and see what kind of barriers, successes that you guys are having with your quality improvement efforts. It's always interesting to kind of visit and see how everyone is so similar, but yet very different across the state. So if you have not touched base with your HQIC lead, please reach out to either myself or Dana, and we can definitely get that scheduled. But we also do want to support you by doing some on-site visits. We've done several on-site visits in the past couple months, and I know during the pandemic, a lot of visitors have been limited. So we would like to kind of restart that here in 2022, as long as COVID slows down. But again, we want to just see your beautiful hospitals across the state, showcase. This is your kind of chance to showcase all of your quality efforts. And I know that the hospitals that I've visited, we got some really great facilities out there. And that's the fun part of, well, this job is always fun, but visiting you guys and seeing your hospitals is great. So we do also want to offer some specialized performance improvement assistance. We know that a lot of you have been quality leaders for a long time. So, and I know from experience that it's always the quality leaders that have to kind of start that change for process improvement. So a lot of times, if you have like difficulty with buy-in or staff engagement and you need an outside person coming to a nurses meeting to kind of to define why we're doing this, or to show why it's important. Sometimes it's good to hear it from an outside perspective. So that is something that we would love to start here in 2022. If you're struggling with something, or if you just want an outside opinion, we are here to help you guys, and that's something that we want to offer you. So that'll kind of lead into our 6 meetings for success, and I'll hand it off to Dana.
Okay, so some of you may have heard this presentation, and all of these are linked to the Hospital Association website. All of the tools and her video when she did present to us is on there. And really what it is, I know, like from my experience too, you start a project and sometimes it feels like it can just drag on forever and ever, and you don't make a ton of progress. So the goal really of this model is just to make your meetings actionable and useful. As we all know, there's just no extra time ever. So these are some things that we're really going to try and help implement. We're going to try and implement even in our work, because to have a meeting just to have a meeting is not a value added event. And so really it just talks about moving through 6 meetings in a timely manner to really create change and actionable items so that your process improvement projects are moving along the way that you want them to. So go to the website and look at those tools. And these might be some things that come up in the, as we talk through things with you, or if we come out to your meetings, this is just some of the verbiage you might start hearing. It's really our goal to kind of try to implement this in things that we are teaching too, because it really is an efficient way to move through a project. So that's just kind of an overview, and hopefully we'll see more of that coming up in 2022 as well. And that's it for us. So anybody have questions, or we won't do a roundtable because we're dangerously close to 11:30, and I said it wouldn't take an hour, so I was false in my prediction, which is okay because it was all good. But anybody have questions or things they want to get out there before we wrap up here? Anybody? Okay, so the next meeting, so the regularly occurring office hours are going to be the 3rd Friday of the month from 12 to 12:30. They may take 30 minutes, they may not. It's really going to depend on what we have for content. They won't be real formal. It'll just be a quick update, give you guys a chance to let us know what you're hearing out there, or if there's something you want us to do some investigating on, we can holler at that meeting and work through that and give updates too. So the goal really is just to keep everybody on the same page on a regular basis. So if you have ideas for that or things you'd really like to hear on that call, shoot us an email as well, because the idea is for it to be useful for you guys. So meeting requests will be, I don't know, did I already send those? I don't remember. If you haven't seen a meeting request, one will be coming. And I think that's all we have. Amber or Margaret, what do you guys have in closing? Anything else?
I don't have anything else other than Merry Christmas, and I hope you guys can enjoy some family time.
Absolutely, and hang in there. I know things are tough right now, especially in our rural communities. So, well, I shouldn't say that. I think it's tough everywhere. So we're thinking of you, and let us know if there's things that we can do to support you in any way. Thanks, guys. Merry Christmas.